From NBC News World Headquarters in New York, this is NBC Nightly News with Brian Williams.
After a break, we'll be back with our special series here tonight on cutting-edge medicine without the surgery. As we've been reporting here in our week-long series on the future of medicine, there are all kinds of new techniques out there for fixing medical problems with less pain and shorter recovery times than ever. The question is, why don't more doctors tell their patients about them? In conjunction with Newsweek magazine, here is NBC News Chief Science Correspondent Robert Bazell with tonight's special report, Life-Saving Medicine. What's our future?
The benefit of this is there is no downtime.
Bruce Tempone is undergoing treatment for varicose veins in his legs.
Right. Turn a little bit more.
In the past, this would have required surgery with a day in the hospital and weeks of recovery.
I'm going to move the laser fiber in place. This won't hurt a bit.
But with the help of ultrasound, Dr. Robert Min guides a laser repair device into the veins. The entire procedure is over within an hour, and Tempone recovers immediately.
Everything's done, everything's out.
The vein repair is one of dozens of procedures that fall into the expanding field of medicine called interventional radiology, often replacing more costly and difficult surgery. Doctors can now repair all sorts of organs by running tubes through various blood vessels. They're guided by live images, such as X-rays, ultrasound, or MRIs.
They require less anesthesia. Certainly interventional radiologists who do these minimally invasive procedures help minimize those costs.
Here's the two catheters. One catheter.
Interventional radiology can be an alternative to dozens of surgeries, including repairs inside the brain.
This is very gentle. The patient's awake, cooperative.
But often patients are not informed about the less invasive alternatives. Many say this is a huge problem for a treatment for fibroids that allows women to avoid a hysterectomy. One reason that patients don't learn is that interventional radiology is relatively new.
Everyone knows what a surgeon does. Very few people know what an interventional radiologist does.
But another factor can be surgeons fighting to keep lucrative business.
Isn't it true that a lot of times the main consideration is how much the doctor makes for doing the procedure?
Yes, I think that is a driving force, and that's a reality of medicine like any other field or business. This is where we entered the vein.
Increasingly, patients like Bruce Tempone are learning from friends or on the internet that sometimes there can be an alternative to surgery.
It went well and it was a snap.
Robert Bazell, NBC News, New York.
It was very